What if I told you that in just 10 days, millions of Americans could start feeling the real effects of this government shutdown? And many people still don't realize how it could directly impact their Social Security, Medicare, or even food benefits. And here's the part that's not being talked about enough. If the shutdown continues into November, it won't just affect government workers. It could delay services millions depend on, from monthly SNAP and WIC payments to the processing of Social Security claims and Medicare renewals. If you've been hearing about the shutdown but aren't sure what it actually means for you or your benefits, don't worry, I've got you covered. In the next few minutes, I'll walk you through exactly what's happening, how it could affect Social Security, Medicare, and food assistance programs, and what you can do to be prepared before that 10-day clock runs out. What's happening? As of now, the U.S. government has been shut down for over 3 weeks, tied for the second longest in history. Congress has yet to pass a budget, meaning large parts of the government no longer have the funding to operate normally. That may sound like political gridlock, but here's what it really means in plain terms. Federal employees aren't getting paid, agencies can't process new applications, and funds for critical programs start running dry. One of the first programs to be hit: SNAP, the food assistance program that helps more than 42 million Americans, including millions of seniors on fixed incomes, afford groceries. States like Texas, Pennsylvania, and Illinois have already warned that November benefits may not go out if Congress doesn't act by October 27th. That's just days away. WIC, which helps low-income mothers and young children get nutritious food, has enough money to last through October 31st. After that, states say funds will run out unless the shutdown ends. Officials are calling this situation unprecedented, warning of a devastating impact on millions of families. And if that weren't enough, food prices are already rising, up more than 3% compared to last year, putting even more pressure on those living on a fixed income. Why it's happening? This shutdown started because lawmakers couldn't agree on funding under the new One Big Beautiful Bill, the massive federal budget package currently at the center of political fighting in Washington. Both parties are locked in a standoff over spending levels for programs like Medicare, Medicaid, and SNAP. And while political leaders debate, real people are caught in the middle. This shutdown could also be more damaging than any before it. That's because for the first time, the president has signaled he may withhold back pay from furloughed federal workers, something that's never been done in previous shutdowns. If that happens, consumer spending could drop sharply, hurting local economies and small businesses that rely on federal contracts or government workers. Economists estimate that every week the shutdown continues, it costs the economy between 0.1 and 0.2 percentage points of growth, or roughly $800 million a day. If this continues into December, those losses could reach over $1.3 billion per day, money that ripples out into higher prices and fewer jobs nationwide. How this affects Social Security. Now, let's talk about the big question I know many of you have. Will my Social Security check still come? The answer, for now, is yes. Social Security payments themselves are still being issued because the program's funding comes from its own trust funds, not the yearly congressional budget. But here's where it gets tricky. While checks will still go out, services will slow down dramatically. New claims and appeals could take longer to process. Replacement Social Security cards might be delayed. Phone lines and local office wait times are expected to grow much longer. In past shutdowns, we saw backlogs pile up quickly, and this one is already on track to be worse if it keeps going into November. So even if your benefits arrive on time, reaching a representative or getting any kind of change process could take much longer than usual. How this affects Medicare. Next, let's talk about Medicare. Your current Medicare coverage will not be taken away during the shutdown, but again, expect slowdowns. That means delays in processing new applications or plan changes, slower responses to billing or coverage questions, fewer staff available to help with open enrollment issues. And since we're now in the middle of the Medicare open enrollment period, these delays could cause confusion for people trying to compare plans or make updates before the December 7th deadline. If you're making changes to your plan, try to do it early. Don't wait until the last minute. The longer the shutdown continues, the slower those updates will go through. What this means for you. For millions of Americans, especially seniors and lower-income families, this shutdown isn't just about politics. It's about whether essential programs can keep running. Here's what to keep in mind as the November 1st deadline approaches. Social Security payments are still going out, but customer service and claim processing will be slower. Medicare coverage continues, but open enrollment support may be delayed. SNAP and WIC benefits could be interrupted in several states if funding runs out. Federal workers and contractors are already missing paychecks, which will ripple through local economies. Even if you're not directly affected, you'll likely feel the impact through higher prices, service delays, or reduced access to government programs. Just pausing for a moment to share something that could really help you or someone you care about. If you're 65 or older, or helping someone who is, you probably know how overwhelming Medicare can feel. The mailers, the endless calls, all claiming they have the best plan, it's exhausting. When my team and I were looking into this, we came across Chapter, and what stood out wasn't just that they compare all 24,000 plus plans. It was their story. The founders built Chapter after their own parents got stuck in the wrong Medicare plans, and they realized just how many people were being misled or pressured into making choices that weren't right for them. That's what makes Chapter different. Their advisors aren't paid to push one plan over another. They're salaried, independent, and genuinely there to help you. You'll speak with a real person who takes the time to understand your doctors, prescriptions, and preferences and helps you make a decision you feel good about. And the call is totally free. No pressure, no gimmicks, just honest support. If you're already in the right plan, they'll tell you. And if not, they'll help you find one that better fits your needs. If you want to talk to someone today, give Chapter a call at 615-639-1937 or visit askchapter.org/money. Again, that's 615-639-1937. It's free, and it might save you a lot of stress. All right, now let's get back to it. What you can do. If you depend on any federal benefit or know someone who does, here are a few steps to take right now. Check your state's website for any updates on November SNAP or WIC payments. Budget conservatively for the next few weeks in case there are short-term disruptions or delays. Handle Social Security or Medicare paperwork early. Don't wait until the end of the month. Save key documents or confirmations in case you need to prove eligibility or resubmit information later. And if you have friends or family who might be affected, share what you learn. Many people don't even realize how soon this could hit. So what do you think? Will Congress resolve the shutdown before the 10-day deadline? Or are we heading into November with even more uncertainty for seniors and families? Because if nothing changes soon, millions could wake up next week to find that the safety nets they depend on, from food aid to healthcare, are suddenly on pause.